Welcome to today's mobility session. Today we are focusing in on the hips and knees. Let's just take a minute, get yourself comfy, lying flat on your back. Take a few minutes to clear your mind of anything going on in your life that's bringing you any kind of anxiety or stress. Just imagine breathing it all out on your next exhale. Mentally go to your happy place. Just allow yourself to be present and focus on the moment. And take some attention to your breath. Let's start to direct that air deep into that diaphragm. Feeling that belly rise in the inhale, and slowly sighing it out in the exhale. We'll take a few targeted breaths based on our routine today. On your next exhale, imagine getting nice and soft through those quads, your hamstrings, your glutes, letting go of any tension, pressure, and just feeling those hips sink heavy into your mat. If you like counting your breaths, if you find that helpful, counting the duration of the inhale, your hold, your exhale, and your hold, feel free to do that. That's always there for if you need it. It's not required, but it is a nice way to stay progressive. Let's take one more breath here. As you sigh out that breath, we'll transition into a left adductor release. So we find this easiest to access using the fingertips. You can use a kettlebell or an object on the groin, that adductor area. We're going to be demoing the fingertips option. So just start by working your way through that inner thigh, feeling for anything that feels restrictive or tense or knotted. And settle into the right amount of pressure for those tissues. And becoming a master of finding that right amount of pressure just has to do with listening to your body. The only one who's going to know what that right amount of pressure is you. And we do want this program to be progressive. So try to be conscious of applying a slight higher amount of pressure every time we get into an exercise. And always being conscious to how that body's responding. If we get any pain or numbness or tingling, just ease off on that tension and find the right amount of pressure. Let's take one more breath on this side. As you exhale, we'll switch to the right side. So if you found a good spot on the left, feel free to start around the same spot on the right. If you find a similar tension on this side, feel free to stay focused there. If it doesn't feel the same kind of tension, just keep looking. Look for what needs attention here. Settle into the right stimulus, the right amount of pressure. Keep working your way through. Trying to find that happy medium between where we're not really getting much results and where we're getting into pain. Finding that happy medium where we're getting that good, deep amount of pressure without any outrageous discomfort. And once we're there, settling back to your breath. This is a fairly active exercise, but maintain a nice, slow, rhythmic, deep breath that helps you stay relaxed. And being conscious to turn off any muscle we don't need. Relaxing through that face, through your feet, your lower limbs. Anything we don't need to hold this position in exercise, just let it go. We'll take one more breath here and switch into the left quad. So grab that lacrosse ball and we'll go face down on your left thigh muscle. Start by searching through that quad. Look for what needs attention there. And once you've found that area that's going to be your focus today, experiment with how you're addressing it. The angle you're leaning on that lacrosse ball, the amount you're leaning into it, the amount of pressure. Generally, a higher pressure will give us a deeper release. But again, we don't want to go so intense with that pressure that we tense up other areas or get into pain. Once you've settled into the right stimulus for that quad today, circle back to your breath. Concentrate on relaxing that quad as you exhale. Just imagine it softening and molding into that lacrosse ball. Just getting as passive as you can and keeping as much tension on your breath as you can. Let's take one more good quality breath here. Let's sigh out that breath and we'll switch to the right side. So again, if you found a good spot on the left, feel free to start in that same area on the right. It doesn't mean it will feel the same as the left. Our hips are prone to rotations and imbalances, and that might mean these muscles feel very different side to side. So keep experimenting. The only way to know what needs attention is by playing around with this and experimenting. And once you've settled into that right stimulus, focus on getting nice and chill mentally. Go into your happy place, staying present, and just enjoying some me time. And if you find it helpful, feel free again to count your breath, count the duration on the inhale, the hold, the exhale, and the hold with the breath out. And that might be a 4 count of each, might be a 3 count of each, might be an 8 count. It is a nice way to stay progressive with your breath and help increase the benefit from your breath, but it's not necessary. Let's take one more breath here. We'll sigh out that breath and shift into the left TFL. So the TFL sits on the outside of the crease of your hip. And this can carry a lot of tension, can be really sensitive. So settle into the right exact spot that needs attention today. Settle into the right amount of pressure. Concentrate on your breath. Do your best to sync your breathing to that target area. And just let that TFL mold itself around the lacrosse ball. And you might just want to sit here and relax. You might want to move a bit on that lacrosse ball. There are benefits to both. You can change up the direction you're moving. You might move side to side or front to back. It's all fair game. Just feel out whatever feels right for you, whatever gives you the most benefit. I'll take one more breath here. Nice relaxing sigh out of that breath on the exhale. And we'll switch sides. So we're working our way through that right TFL area. Start with a quick search. A small change in position and angle can really change how this feels. Try to avoid settling into your comfort position. If you've been doing this for a while, try to keep changing it up. Settle into whatever tissue needs the most attention today. And that will change day to day. It may stay the same. The only way to know is by trying stuff out. Once you've settled into that right target, concentrate on getting passive. Maintaining that nice rhythm and depth of breath that helps your mind relax. And let that nice relaxing vibe just work its way through your whole body. There are a few muscles we need to hold this position, but there's a lot that we don't, and they can be tense. So anything that feels tense right now that we don't need for the exercise or the posture, just mentally hit that off switch and let that area go to sleep. We'll take one more breath here. We'll slowly sigh out that breath, and we'll move into the left dragon. Let's get into an extended lunge position with that left leg forward. Focus on getting into a nice passive position, relaxing through that hip flexor and quad, allowing those hips to settle forward and down, and challenging yourself to find the end of your pain-free range of motion. And concentrate on getting there by relaxing, not by forcing. In 10 seconds, we'll gently get active by activating through that right hip flexor and your left glute to attempt to lift your hips in the opposite direction. Let's go ahead, attempting to move your hips up and back, slowly ramping up that tension as we go. Let's give a good squeeze here for these last 5, 3, 2, 1, and let's gently reverse. Actively pushing those hips forward and down, ramping up tension as we go. Really squeezing here for these last 5, 3, 2, 1. Big breath out, relax, get nice and passive. Run through a quick checklist of any muscles that are tense, that don't need to be. That might be in your face, might be in your feet, might be in your core. Get as passive as you can and mentally go back to your happy place. Take one more breath here. We'll sigh it out and move into the right side. So let's step that right leg forward into that extended lunge, targeting that left hip flexor and quad. Focus on getting nice and passive. Scanning through any muscle that might be holding us from getting deeper in the stretch. Doing your best to get passive through that tissue. And try to minimize how many muscles are active right now. And keeping tabs on your breath. If you've been counting your breath, feel free to keep that count going. If you start counting and it adds any kind of discomfort or anxiety, don't bother counting. We'll get active here again in a few. And as we get active, attempting to reverse your hips up and back. And let's go ahead, starting with easy tension and pressure. Slowly ramping up that tension as we go. Let's finish with a big squeeze, really squeeze hard these last 3, 2, 1. Let's gently reverse. Pushing those hips forward and down actively, ramping up that tension as we go. Let's finish with a good squeeze here for these last 5, 3, 2, 1. Big breath out, relax, get nice and passive into your basic dragon. Run through your checklist again. Anything that's on that doesn't need to be, whether it's your face, your core, your hips may be overly tense. Anything we don't need to hold this position, just let it go. Let's take one more breath here. We'll sigh out that breath. And let's have a seat on your mat with your legs extended straight out in front in a seated fold. And just start by letting your torso drop towards your ankles. Feeling for a stretch in the hamstrings, the back of the knees, maybe a little bit in the calves. Concentrate on getting passive. Don't worry about keeping a super straight back or anything active. Challenge yourself to get as passive as you can. Circle back to your breath. Use your breath to calm your mind. Use your mind to calm those hamstrings. And in 10 seconds, we'll gently get active by attempting to reverse the stretch. It can be helpful to grab a hold of your ankles. And let's go ahead, starting with nice easy tension, pushing your heels into the floor, attempting to lift your torso back, ramping up that tension as we go. Really squeezing here for these last 5, 3, 2, 1. Let's gently reverse. Activate through your hip flexors, through your core, actively pulling deeper into that stretch, ramping up that tension as we go. Really squeezing here for these last 5, 3, 2, 1. Big breath out, relax, get nice and passive. Again, run through your checklist. What muscles are tense right now that don't need to be? Your mouth, your neck, your face, your legs, your core. Just let it all go. Let's take one more breath here. We'll sigh out that breath. And we'll shift into some left knee traction. So still from seated position, let's grab a hold of your shin, your left shin with your hands, both hands. And what we're gonna do is gently tug the shin away from your body, along the length of your leg, and gently twist it inwards. And if this is a new exercise, err on the side of going nice and easy. We're not gonna feel much here. The goal is really just to create a little bit of space in that knee and allow those surfaces to glide a little better. Each rep, just a tiny bit more pressure added. Again, staying within the limits of your pain. It should be 0 pain, and that is a hard rule. Just work your way through this minute. Push that shin bone away from your body and gently turn it inwards. We'll finish off this rep. Let's sigh out that breath, and we'll shift to the right side. So both hands grab firmly on that right shin. Little tug on that tib fib, pulling it away from your knee or away from the core of your body, and gently turning it inwards towards your other leg. And again, if it's a new exercise, go nice and easy. Pay close attention to how your body's responding. If there's any pain with this, just really ease up on that tension. It is a hard rule that we have 0 pain through this exercise. And you may not feel much at all. The only goal is to free up a tiny bit of space inside the joint to allow it to move better and glide better. And if things are feeling okay, a little bit more force on this last rep. We'll slowly sigh out that breath and transition into a child's pose. So our focus in the child's pose is on the knee. We do this sometimes for the shoulders, sometimes for the thoracic spine. Our focus today is on the knees. So allow your hips to sink as close to your ankles as possible to get into as deep a flexion in that knee as we possibly can with pain free. And again, a hard rule. We don't want pain here. We just want stretch. Shouldn't feel much at all. Just allow yourself to sink into a deep knee stretch. Concentrate on your breath. Get nice and passive. Turn off any muscle we don't need. And in 10 seconds, we'll gently get active through the knee, through those quads, gently attempting to reverse the stretch. And let's go ahead, gently pushing that shin bone into the floor, ramping up that tension as we go. Really giving it a good squeeze here. These last 5, 3, 2, 1. Let's gently reverse, activating through those hamstrings. Attempting to pull your hips closer to your ankles. Ramping up that tension as we go. Giving a good squeeze here for these last 5, 3, 2, 1. Big breath out, relax. Get nice and passive. Concentrate on your breath. Turning off any muscle we don't need. Mentally go into your happy place. Just being present here for this moment. And let's take one more breath here. And as you sigh out that breath, we'll call it a day. Thanks so much for joining us here today with some 5-pillar mobility. Hope you enjoyed this session. Hope your hips and knees are feeling great. If you enjoyed the video, remember to like and subscribe. We'll see you again tomorrow. Have a great day.